It's Dr. Tamara Beckford with Your Caring Docs, where we go and we help you with all this health and wellness information. We break down complex medical info so that you can know what's going on within you and your body. And boom, we got this really cool segment called Your Caring Docs, Docs Who Care, where we bring on docs from all over the world who also educate inform us about medical health and wellness info that they specialize in, right? And they leave all the info so you can always get in contact with them. Boom, who doesn't want that? So today we have Dr. Diana. That's right, representing from the H Town, that's Houston, Texas. So Dr. Diana went to the University of Texas Health Sciences in Houston. Then she did her family medicine residency in Baylor College of Medicine. She is a medical director and she's also a chief clinical medical officer at a clinic in the Houston area, and also she is a clinical director at a nursing home. Recently, Dr. Diana has her certified life coaching. Yes, so she's gonna let us know all about that. Boom, in our interview. But today she's going to drop all the bomb and info about ADHD in adults. That's right, it happens in adults also. So she's going to let us know how she tackles that, how she battles it, and she's going to help you out there who is an adult there with ADHD. So before any further ado, let's represent Dr. Diana.
Thank you, Dr. Beckford, for that awesome introduction. I love the energy, and I'm so excited to be here with you today. So let's get on a roll and have a party.
All righty. I love it. I love it. So, before we go any further, give us a little background about yourself. Tell us. Inquiring minds.
Yes. So, I'm Mexican American. I actually grew up in Mexico till I was 10. My parents were immigrants, and they would get permits to come to different states so that they could work for seasons. So that's how I was born in Texas, but I didn't really get to. I guess use that right till I was 10 when my mom said, okay, this is the third kid I've had. Your dad works in Houston. We should all move to him so that we all can be together. So we ended up, moving to Texas when I was 10.
Mm-hmm.
And so because of that, given that English now is going to be my second language, I was kind of held back a couple of years. So, but I was very determined to learn. I remember one of the first things I learned was the word also, ALSO. For me, that meant bears. So I kept, every time they would say that over the intercom, I would be looking around waiting for the damn bears to come, but they would never come. So I would be always where are these bears that they're talking about? So it was, lots of funny stories, how sometimes what other words sound like in different languages end up being something else, and how you're always curious and wanting to learn different things. So I worked hard to try to catch up with it, and I did well. I actually ended up getting back to the grades that I had missed because I was so determined to learn. Looking back, I guess I didn't realize I had ADHD, but I was always in trouble. My parents had to come and sit there in the classroom so that I would not go bother everybody else, because I had finished my work and they had already given me extra work and I had completed that extra work, and I was still kind of disrupting the classroom because I was so bored, right? And so that's how they ended up promoting me back to my grade level, so to say. And so I guess I was doing well academically, so they never thought, oh, that might be ADHD, and so it was not until I got to medical school that in my first semester that I was diagnosed with ADHD. But looking back, now I can put it together, because in high school I was a cross country athlete, so I would run 10 miles a day, and of course that's dopamine, and I was in the dance class and that's dopamine. So ADHD is something where sometimes the dopamine is not as high as it should be. So therefore you can't focus or function. And the things that you do love, you super excel and hyper focus on. And the tasks that are not like, that are boring, or you're not like, oh, I can't wait to like do the dishes or like clean my
Yeah,
house, or like, you know, when you're working, like I can't wait to do a paper or something that to somebody with ADHD can be like a big task, a big executive task. um, you always had that feeling of like, I don't understand, she's so book smart but she doesn't have any street smart, like that's what they would keep saying. And it was this sensation that there was something a little bit off, like why couldn't I apply the knowledge that I knew from studying and not do it like in my own personal life. So anyways, I didn't even have any idea when I actually it was advised to me that I go get checked to see if there was something wrong. It was my one of my best friends. She's like, Diana, I see you studying 80 hours, 90 hours for this medical school stuff, and like you're barely passing the test or not passing the test, and you're not even finishing the test. So something is wrong. Like I talk to you, you tell me, how come you're not doing it on the exam? Like what the hell is going on? And so at that time, it was it was a time to try to tease out whether I was anxious because like I was putting all this pressure on myself, like I had to pass this test. I'm the first one to go to college. I'm the first one to go to medical school. Like I better like do this for me, for my family, because otherwise like it's horrible, right? Well, that's what I was telling myself. Now looking back, it's just a damn test. Like it would have been okay, right? But when you're in it, like you don't realize how much we make certain things mean. And 5 years down the line, like whatever we're worried about was really nothing to be worried about. But in that moment in time, you just can't like get out of that thing, right?
absolutely. But
So
during that
so that's
time,
where I got tested, you know, to figure out whether it was anxiety or whether it was that I just could not have enough attention to finish the test.
so this was in med school where this brought up.
Yes.
I think this is really interesting because I have a brother who is applying to medical school. And interestingly, your story sounds just like his, where he, undergrad, graduate school, he's doing the 80 hours and just going hard. And then he's like, I'm not seeing the representation in the grades from what I'm putting out. So he actually went to the at the school and got tested and recently found out that it's the ADHD. So this is indicative of so many adults who are there, who are putting out all this effort, and others might start to bring a stigma. It's bad enough the stigma that you bring to yourself, right? But what about the stigma that others might bring to you that like, you're not working hard enough? Have you heard any of these? You should do a little bit more, and you're like, well, I'm doing all that I can. So what is it that when you saw all of this, how did that make you feel? And how did that translate into what you're doing now to help others?
Yes. So it's a good thing that you just pointed out that example of your brother,
Mhm.
because that's where the big misunderstanding happens. Like physicians were taught like 10 years ago
Mhm.
that you outgrow ADHD. Okay. And like that actually happened to me. Like I got told that, like, I got diagnosed in medical school. They gave me some medication. It helped wonderfully. And then when I finished my residency, they said, okay, you need a new attending. I mean, you need a new physician because you're an attending now. So I picked up a random name. I have a new insurance now. I'm a full attending. I'm a full doc.
Right.
And then that physician was like, I don't even think I spent more than 3 minutes in the room. Like that physician just said, you're a physician. You should know better. You outgrow ADHD. And like he walked out. Like that was it. And so because like you just said, like there's such a big stigma to it. Like I already was like telling myself all kinds of things because of the diagnosis, right?
Mhm.
And I was telling myself, you're a physician. You like you should be type like you should know everything. You should be perfect. Like you cannot afford to like not know everything, right? And so when that specialist told me that, like I internalized that belief. I said, "Oh my God, he knows better. Like I should outgrow this." So then my thought that I kept telling myself was, "Suck it up, Buttercup. You've got this far. You're gonna figure it out," which is a problem because now, of course, 8 years later, I know better. I know that I should have told that doctor, "Excuse me, you just met me for 3 minutes. I need to find myself a specialist who actually understands adult ADHD and can treat me."
Mhm.
Because ADHD, yes, medications help, but it's not just medications. And I wish that was something they would have taught me when I was a medical student,
Mhm.
that there are other ways to help yourself, that you can get a coach, that you can get a therapist, that you can get so many different tools. So what I'm trying to get at is that your brother and I are among what is very common.
Mhm.
In the book ADHD 2.0 by Dr. Hollowell, he talks about how adults usually, we have all the characteristics throughout childhood, but we tend to do well intellectually. So it just kind of gets dismissed and they just don't think anything of it. But you hit a wall at some point
Mhm.
where either you get to college or you get to grad school or you get to law school or medical school, where the amount of information that is coming at you is all the things that you used to do, they just don't work. It's like you're saturated, like that's it, like you've done everything you've done, but the executive functioning just can't do it. And
Right.
so it also happens for females after the birth of a first child, because now not only do you have to get so organized like in your own life, but now you have to do everything for this baby so that they can eat, sleep, feed, like everything plus you. And so it's such executive functioning that it just kind of puts you over the edge. And then you put together with the no sleeping part, forget it's just like spirals, right? Like it's just like that. Or when you all of a sudden get promoted, because that's the thing with ADHD, you don't realize how many superpowers and the ability to be able to form relationships with others, to think outside the box, to be empathetic. So you're a leader without even trying. You're just kind of, I say, you have diarrhea of the mouth. You say what everybody else is thinking in the room, but you don't mean to, but you just say it because it's so in you, right? Which can be good, because just because stuff has happened a certain way before, it doesn't mean that it has to continue to happen if there is a better way. People with ADHD tend to be like, well, why do we have to do that? Let's do it this way, or let's try this way. And we're less objective or less critical because we get it. We have to try A through C until we finally find something that works, right? And we don't make it mean anything. Now, to everybody around us, that must be very frustrating because they're like, what the hell? Like, just do something, child, right? But to you, you're like, what? I'm just trying it out. I'm just trying to see what works, right?
Absolutely.
So, so the point is that not until you get promoted, and now you have all these responsibilities and all this administrating stuff. Because remember, we like to do things, but then when you have a sit down and like give you all the details, we're like, can we just talk about the big picture here? Why
That
do
is
you need all that from me?
the details start to overwhelm the words that we don't want to use. The big O word, overwhelm. You know,
Exactly.
trying to tease it. So
Yes.
with you going through this process and with that you've learned, you've mentioned a couple of things which I think are important, in that there's more than one way to treat ADHD, that medication alone is not the only way. So give us some steps, because you mentioned some things about coaching, medication, therapy. Let's go over some of these different techniques and how important it is overall in helping someone with ADHD.
Yes. And let me just answer the a previous question, which I don't think I told you.
Mm-hmm.
According to the Diagnostics and a Statistical Manual of the Mental Disorders in ADHD, the fifth edition, which is the latest one, it says that in adults, there's about 5% of people with adults. And it's in, they say it goes back and forth. They say 5% in child, 5% in child, and then 2.5% in adults. But in other places it says 5% in adults, and in other places it says like it's way underestimated anyways, again because we go back to what you just mentioned, the inability, like the stigma, the inability to like recognize that is not just life, or it's just not, I'm too stressed, right? And so I wanted to point that statistic out so that you don't think that you're one in few, right? And but going back to this question that you just asked me about how to treat ADHD. So I will have to tell you, like a year ago, I would have just told you what I treat, how I tell that I treat all my patients with ADHD with medications, because that's all I knew. And a
Mm-hmm.
year ago, you would have never found me telling you that I have ADHD because, for one, I thought I might have outgrown it, or two, I thought it was like too embarrassing to say that out loud, right? But I've come so far because I've come to realize that ADHD is just a neutral fact. Like, it's just like me saying I have high blood pressure or diabetes or cholesterol. Like, it doesn't mean anything, right? And you wouldn't tell somebody with diabetes or high cholesterol, hey, only take the medications on the days you want to function. Like, only take them Monday through Wednesday and don't take them on the weekends, okay? Like, it's such a silly thing now that now I'm in this headspace, but it wasn't something I could have seen a year ago. So I say this because I think it's important for people to realize that ADHD can be a gift. You just need to know how to unwrap it. You just need to come to understand it so that you understand that the way your brain thinks is just a little bit different. And it doesn't mean it's bad, it's just a little bit different. I
Mm-hmm.
mean, if you're going to grade if a frog can climb a tree, I mean, it's kind of hard, right? So it's the same thing. You can't compare my brain to somebody else's brain, but you can become curious and figure out, how can I use this to be a gift for me? How can I use it to help me not work against me, right? So with ADHD, this whole last year, I've learned now that I wasn't in the critical thinking, shaming state. Like you said, most of us tend to be our own judge. Like, we say things to ourselves in our brain that we wouldn't allow others to say, right?
Right.
Because we think that by telling us, like, don't look dumb or don't do that, or like, it's protecting you in the long run so that you don't get hurt by rejection. But think about it. When have you ever performed your best when somebody's treating you like crap? Like, I haven't. I mean, have you been so excited to come give, if you're a waiter and somebody's like screaming at you, can you be like, oh, yes, I can't wait to help you? No, right? So it's the same thing. If you are telling your brain you're worthless, or you're not doing it fast enough, or whatever, it's not going to perform at its peak. So I wanted to get that out of the way so that you don't keep blaming yourself for whatever things you think are lack of character, which might be just the way your brain thinks. I'm not saying it to give you an excuse or a way out, but to give you an awareness so that then from there, from a place of like, let me understand my brain. How can I, one, take responsibility, right? Because you still don't get just because now you understand your brain doesn't mean you don't become responsible for it. But now at least you're at this stage where you're like, okay, what can I do to help me to become what I want to become? So there's books. One of the books that I love and I would love everybody to read, or do like me, audio. I like to do the audiobooks because then I don't have any excuse. I have to drive back and forth, and I can listen to that and take that information and then decide if I really like the book. Then I can buy the book if I want to follow along. Otherwise, I'm gonna tell you, most people with ADHD, we always want to self-help, but we don't want to sit down long enough to read the whole book. So
Right.
audiobook is perfect. So ADHD 2.0, it's the latest and greatest. It's a book by a psychiatrist. He
Mhm.
himself has ADHD, and he has written like 20 books over the course of his whole career. He's actually in his 70s now. But this psychiatrist writes about the latest and greatest scientific information with ADHD. He talks about how now they can use MRIs to see the different parts of the brain that people with ADHD lights up. And he says that we are creative, and he talks about how we, like I just told you, sometimes just because we have all these like awesome ideas, we also have, he calls it the angel and the demon. We have this little demon who says that's not good enough. It's like that awesome person who just made like a killer album, right? But they don't think it's good enough, so they don't even like publish it. But if had they just like put it out to the world, they would have like rocked it, right? So what he says is that you need to realize when you are spiraling or your devil is like talking to you, do anything. He says, fry an egg, jump on a leg, like go, like, he's like, go fart, dance, do whatever. He's like, that gets you out of that negative loop.
Mhm.
Use that distractibility to your advantage to get back on track on doing what you want to do. So, by saying that, that book, I really feel like I finally felt understood when I read that book. It finally made sense why I had such a transformational year, because it talked about, like, just like I mentioned to you, how sometimes females get missed.
Right.
And it just mentioned how in children you can see this. And it just mentioned how the power of just having self compassion
Mm-hmm.
can make the whole world of difference. Because when you are always telling yourself you're less of, but then when you realize I'm just human, I'm just doing the best that I can with the gifts I was given, then it's such a different like way of showing up, right?
Yeah. There's a weight that's lifted off of your shoulder. So we said that we have a book, ADHD 2.0 is one book that you do recommend. You also mentioned coaching, right? So tell us a little bit about that. How
Yes,
is yeah, how is coaching helping those with ADHD?
yes. I I have experienced two types of coaching. I
Mhm.
have experienced life coaching, and I have experienced ADHD coaching. So those two are very different, and I want to make a distinction. And luckily, I get to do both together, so it's like pretty awesome for me. But life coaching, anybody and everybody can benefit from. I didn't even know what life coaching was. To me, it sounded like taboo. It just sounded like who the hell, whatever, right? But I came to discover life coaching because I listening to a podcast. I'm always trying to learn from podcasts. I learned about a program called Empower Women Physicians that was talking about how you could get like some credits for your medical license, plus you could learn how to improve your style of living. So I decided, let me try that. From there, came to realize that life coaching was about figuring out what problem, and sometimes you don't even realize it's a problem, right? Because that's the thing, most of us live life by default. What that means is that, well, we get up, we just see what happens, and then that's it. But we don't sit and wonder, how can I make this life be the life that I want? Like,
Mhm.
if I were to die tomorrow, did I spend the time I wanted with my family? Did I work at a job that I love? Like, you don't think that because we don't think we're going to die tomorrow. Nobody thinks that way, right? But when you live a life of intention, which is not just reactive, you learn now to have goals and dreams. And so with life coaching, it's not therapy, where in therapy you look to see, oh, what went wrong? You know, how can I heal those wounds? But with life coaching, it's like, okay, I want to get to B. How do I get there? Like, what do I need to be thinking? What do I need to be feeling? What actions do I need to take to get me that result, right? So that is what life coaching is. So that sounded cool. But if you go back to ADHD, you need to have executive function. You need to know how do I prioritize? What is more important to get to be like, I have 10 things that it's in the back of my mind. Which one of those is really the one, right? And how can I focus on one thing, not on all 10 at the same time, so I'm not paralyzed by overwhelmed, right? So with ADHD coaching, it is very different from life coaching, because with ADHD coaching, you have to develop systems and habits, and you have to figure out where is it that I kind of lose it. In what step of the process, why didn't I get to the 100 complaint completion, right? Most of us with ADHD were like super spontaneous and super excited of the next best thing. And we have what they say, 100 started projects and non-completed, right?
Oh.
So when you start to figure out, wait, let me back up. I'm excited about this. How does this really tie into my long-term goal? Is this thing that I'm about to do going to bring me closer or further from what I want? Do I have to focus on that right now? Like, is that going to get me like what I want tomorrow? Like, if my plan was to go have dinner with my friends, like, is me looking on Facebook right now going to help me finish my notes so that I can have dinner with my friends tomorrow? So it's those analyzation of your day, figuring out what things we are doing that are actually helping us or hindering us, and why are we doing them. So that is very different from life coaching. But together, when you mix them both, all of a sudden it's like, bam, you know what your values are because you sit down and acknowledge. You start to align yourself. You don't become a people pleaser. I was such a people pleaser, and embarrassed to say, I would lie because I didn't want to hurt other people's feelings.
Mm-hmm.
And I didn't want to feel rejected, because people have a very emotional hypersensitivity with ADHD. Like, you feel rejected, like you feel it in your soul. Like, because remember, this is something like 2,000 years ago. If you were not part of the tribe, you're going to be eaten alive. Like, that's it. You're going to be eaten by the bear because you did not pull your weight with the group, right? So that kind of stays in you, and you don't realize that, oh my God, not staying in my truth, even though it's what I want to say, it's going to hurt me in the long run, because those little lies become bigger lies. And remember, we already have bad memory, and trying to keep up with who the hell you said what to just gets you into more trouble, right? So it goes back to being true to yourself and learning to say no from a place of love,
Right.
setting boundaries from a place of love.
Mm-hmm.
I love you, but no. Because when you say no to some things, then you're saying yes to yourself, to do the things that you finally learn how to prioritize with your coach, because otherwise you didn't know what you wanted to do. You didn't know why your days like gone again. Remember, we don't lose months. We lose days and hours, right? And so those add up.
So, what are some direct tips that you have to help them focus so that they can get that extra 30 minutes per day?
Yes.
So that, yeah, that loss isn't there.
Okay. One big tip.
Mm-hmm.
And this is going to be mind blowing and it's going to seem silly. But your mindset, people with ADHD only have two times,
Mm-hmm.
right now and not right now. That's it. So you can understand why, if you tell me, hey, you want to do this Sunday? And you're like, yes. But guess what? Diana didn't put it in her calendar on Sunday. So Diana doesn't remember I'm supposed to have done that Sunday, right? So aware that there's only two times, now and not now, gives you that insight to really say yes when you know the answer, or to say, hold on, let me look at my calendar. So that's one thing that is gonna really help you. And it also helps you in the way of your career. Because
Mhm.
if you're somebody like me who's a physician, um, I don't know. I don't know if 1 minute or 10 minutes or 1 hour has passed, which is good when there's like um, an emergency. I'm like all on it. I'm like, cool as a cucumber because it's just another 5 minutes in my life. It doesn't mean anything. Which I say this so that you can have in your mind that you can do anything you want with ADHD. You can be that firefighter, you can be that doctor, you can be that surgeon, you can be whatever. You would think as a surgeon you can't focus, but believe me, if that's your passion, you're going to hyper focus for hours because that's what you love doing.
Mm.
So, ADHD, mindset, awareness that now and not now, and
Mhm.
awareness how that can be used towards your advantage. Because again, if you go and put it in your calendar, or if something pops up and you remember, oh, I have to pay the credit card on Friday, put it on your calendar on Thursday, due to pay by Friday. Do yourself a favor, do it the day before, right? So you actually have 24 hours to accomplish the task, not the day that it's due, because you might miss it, right? So that's important. Um, okay, I just told you now and not now. The second tip is having an awareness of the fact that we don't have a time awareness. Okay, so you need a cue, whether it's you need an external cue, whether it's your alarm to wake you up in the morning, or whether it's like for me, I tell my nurse, I'm gonna put a timer, and before I walk in the room, after the timer goes off, come and knock on the door. That way, that gives me an external cue that, hey, certain amount of minutes have passed by. I should kind of start wrapping up the visit so that I can get going. Some people might think that's weird, or might think that that's blocking or interrupting the flow of the visit. But now, because again, become so comfortable, I tell my patients, I would love to talk to you for hours. And you know me, we do this, we go back and forth every time you come. But I am trying to be aware of your time, and I am trying to be aware of my time. And because I don't know how long it's been, they're just giving me an awareness. And they don't say anything. They're like, okay, doc. And some people have even said lately, oh my God, doc, I was only waiting 20 minutes. What's going on? And so they used to wait for hours, right? Because you didn't know that hours had gone by, because you were so absorbed by them and love on them. But now you have this external cue that gives you that awareness. And and it could happen the same way. Like, let's say you're in your house and you're about to start studying or something, and you want to have dinner with your family. Tell them, hey, come tap on my shoulder when it's 10 minutes before me needing to go there. Again, it's an awareness, and that's going to save you so much time, because otherwise you wouldn't have known that you've been on Netflix for 2 hours, or you wouldn't have known that you told your husband it was going to take you 10 minutes and it's 30 minutes, and you still haven't even like gotten right. So having an external cue when you don't have that time awareness, that's going to help you. And then the last thing, which is, I think, probably the most important one that I invested coaching and time with with my ADHD coach, is the planning.
Mhm.
And when they told me that, of course, like, the first thing we want to do is like vomit, right? We're like, planning? What the hell? Hell no, I'm spontaneous. Can't you see? Like, can we just wing it? But oh my God, has planning helped me save so many hours of my time. Planning has helped me not show up at the wrong clinic on the wrong date at the wrong time. Um, Planning has helped me be able to get to my kids like little birthday party or their little grandma's day or whatever they have, because I knew ahead of time to tell my staff to block that time so that I could be present for the things that I wanted to be at, right? So that's the thing. Planning, and a lot of people think, oh, it's going to take a long time. It doesn't. If you figure out, again, we go back to what are your wants? What are your needs? What are your values? What am I doing just to do and is not really providing what I want to get at the end of the day, right? So those are the things you start to delegate. Those are the things you delete off your list so that then you do the things that are important and you get the stuff done. So with planning, a lot of people with ADHD tend to be optimistics.
Mm-hmm.
They think they can do 100 things in a day. Like they have like 300 hours into a 24-hour day, okay? And that's where the problem begins because you might do 10 of those 300 things and you still feel like crap because you didn't do enough. That's what your brain tells you, which is not right. Again, planning to do one or two things that are the most important thing to you. And I don't mean like big things. It could be literally 10 minutes reading with your kid because you wanted to spend that quality time. Like those are things when you plan, when you spend those 5 minutes of your day in the morning, when you wake up and you put my two things that I have to do today are these, then you have a map, right? Most of us want to say, oh, we'll just wing it or I'll just keep pedaling. Well, yeah, that's the problem. You can get off the damn bike and go to the car, put the GPS and get you there, right? If you don't know where you're going, how are you going to get there? You
Absolutely.
need to plan. You need to plan. So
So
you plan your day, you plan your week, you plan your month. So 5 minutes to plan your day, 30 minutes to plan your week, and an hour to plan your month. And that just helps you save tons of hours, tons of frustrations, tons of disappointment to you and to the people around you.
So by the time you finish doing all that, you've gained back a couple of hours out of your day. All right. Well, we're about to wrap this up. You've given us some great info, but we do want to know one more thing from you, Dr. Diana. So, all right. Tell us a fun fact about yourself. Let us know.
Okay, fun fact.
Mhm.
I love to do Zumba. Okay, you'll find me doing Zumba like 5-10 minutes in between patients at lunchtime to get that dopamine up or to reset my brain. If it was going into funky mode, you want to hear me resetting my brain, or just to enjoy life. So Zumba is so fun. Now, you don't have to spend a lot of money. You can go on YouTube and literally type in Zumba channel, and you'll find all kinds of cool workouts. And the cool thing again is you just try a different one. So that's cool because your brain does not want to get bored, right? So you just try a new one. Another fun fact: if I wasn't a physician, I think I would spend the rest of my life like talking to people about the places they want to travel to and like making their dream vacations. I
That
think,
extraordinaire.
yep, like making it happen. And so, yeah, I foresee having some awesome ADHD retreats in funky places like Croatia and Costa Rica just because I love to travel.
Oh, well, like, hey, those of you out there who are listening, who have ADHD, who've been diagnosed as an adult, told that you should have outgrown it. Now you know that's not true. Told that, hey, it's just a medication alone. Now you know that's not true. There's some resources out there for you, right? So in addition to medication, you and therapy, coaching can help, right? And then there's a great book out there for those of you guys who want to know more about ADHD. It's called ADHD 2.0, right? Give you an insight as to what's going on. And also tapping it out in that planning and knowing that your time frame is a little bit different than others, right? Is either now or not now, right? Mapping out and having some plan for your day, your week, and for the month gives you those extra hours to get things done that you want done, right? To spend the time that you want with your family, your friends, or doing things that you want. So, Dr. Diana, we thank you for coming on Your Caring Docs and being one of our docs who care. Before we go, let us know, where can we find you? And are you taking on adults with ADHD? Can anybody be part of your coaching program? Let us know.
So you can So in terms of where you can find me at TikTok. I'm gonna tell you my handle is Doctor underscore ADHD underscore coach. Okay. And my email address is overachieve with ADHD at gmail.com. But the people that I am helping right now are physicians.
Mhm.
And the reason I'm doing that is because I feel like we need to take care of each other so that we can show up and be the best for our patients as well. But come and learn about everything I'm offering through TikTok.
Wonderful. So all of you guys out there know that Dr. Diana is available on TikTok. That's Dr. underscore ADHD underscore coach, right? So we love you and we thank you for being and spending some time here with us on Your Caring Docs. I'm Dr. Tamara Beckford. Don't forget, you can find us on Your Caring Docs. All this info, boom, 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 is going to be available on our channel. You have our YouTube channel. That's URCARINGDOCS, Your Caring Dogs. We're on YouTube. We're on Instagram. We're on TikTok also. And we're also on Twitter. But most importantly, all of this great info is going to be on our Your Caring Dogs website, which we are revamping. We're going to have all this stuff available. Dr. D, whenever she's ready to drop any more info, she's going to let us know. We're going to have it all up there on our website. So I'm Dr. Tamara Beckford with Your Caring Dogs and our docs who care. And today's feature is Dr. Diana, taking care of us and letting us know about ADHD in adults. Thank you for having us, and we will see you guys next time.